The Medical Minute, bringing you up-to-date medical knowledge for healthier living.
Good morning. It is 7:25 on your Monday, and I am joined now by family medicine physician Dr. Connie Hahn with Bozeman Deaconess Medical Associates. Thanks for joining us today.
Thank you for having me, Lindsay.
No problem. And today we are talking about anxiety.
Yes.
And can you just talk a little bit about what anxiety is?
I sure can. And you know, it comes in two different forms. It can be provoked or completely unprovoked. So being provoked would be having a stressful environment, something in your life that is causing you anxiety. That's a little more straightforward. Being unprovoked is called an anxiety disorder. So in other words, the disorder is there because there is nothing causing an anxiety outwardly. It's all internal. Lindsay, the classic example is the secretary who's at work. It's 10 o'clock in the morning. Everything's going beautifully when suddenly she feels like she's being chased by the tiger. Heart starts racing, breathing increases to the point where many folks feel that they're really going to die and will actually come to the emergency room. Good news is no one's ever died of an anxiety attack.
And why might someone get anxious? You know, what might trigger that?
The most common theory right now is that it's a lack of serotonin in the brain. So that's what I really want everyone to hear. This is not because of your deficits in your personality, or worse yet, your willpower. It's really not about that. It's really about a lack of serotonin, which can run out at any time for anyone, depending on whether or not we're provoked, how deep or long that provocation goes, and whether or not there's a family history.
Okay, I see. And how is this diagnosed?
Good question. You know, most folks, when they come to me, they've pretty much diagnosed it themselves. Not always. Sometimes I'll sometimes I'll find a patient who will just say, I'm having coughing, I am not sleeping at night, I'm short of breath, chest pain. Oh my goodness, if they say chest pain, we're running the full gamut, right? Because we've got to rule out heart disease. But oftentimes when everything else is ruled out, we sit and talk about, is there a history behind this? Is there something anxious going on behind the scenes?
Okay, thanks so much. And you can find more health news on our website at kbzk.com.